Before now, diagnosis of diseases used to be conducted manually by mere physical examination, thereby making medical treatment very slow and difficult. But gradually, through the development in science and technology, scientific laboratories were invented by experts, which has now made medical examination and treatment quicker and easier. We can therefore admit that the role of scientific laboratories towards addressing the menace of COVID-19 pandemic globally cannot be overemphasized. Ibrahim Keita is a scientist in Katsina, northwestern Nigeria, with years of experience in the field of laboratory management, and he sheds more light on how laboratories greatly assist in curbing the spread of many diseases, especially coronavirus.
When you are talking laboratory, generally when you are talking about support laboratory provides, generally in disease outbreaks, is laboratory serves as a key team player or member of the public health response in terms of disease outbreak control and response. Support the team in terms of identifying the right sample to collect when you have a suspected element based on science and symptoms it is presented, even before it is confirmed. And then in terms of COVID now, specifically laboratory, the main role of laboratory is as a team player coordinate the collection of samples. You know, we have for COVID now, we have three key samples, either the nasopharyngeal swab or oropharyngeal swab.
Jamilat Adegulola and Noura Eradua are residents in Katsina Metropolis, and they give their take and appreciate the support of laboratories in fighting coronavirus disease.
Well, so far, laboratories has actually helped in curbing the spread of coronavirus, in the sense that, you know, with the advent of technology, we've got doctors have been able to identify victims, or let me say the carriers of coronavirus, by knowing their status, and then after testing them, you know, they go to the lab to test. When they've picked the victims, they've tested them, they take the test to the lab to know if they're actually positive or negative. Equipment in Nigeria is nothing to write home about, to be honest. We are seeing advanced countries, the way they are tackling this COVID-19. If we were to go by that, Nigeria, we are nothing. So I think government should do more on the provision of COVID-19 equipment.
Laboratory centers, they play a very important role in determining those with COVID-19. Katsina State is a state where the population is almost 7 million. So when you don't have at least 3 or 4 centers, how can you take care of this disease? We need more centers, more laboratory testing centers.
There is no doubt the outbreak of COVID-19 has exposed the weaknesses of the health sectors in Nigeria and other countries of the world in the availability of science laboratories and testing centers, which needs to be addressed to cater for present and future pandemics.
Some of our indigenous, some of the scientists in diaspora, like Dr. Mahmoud Bukarmayana, is working towards establishing a biomedical research and training center in Yobe State. So far, more than 100 million worth of equipments were supplied to the laboratory, and in the near future, it is aimed to be a center of excellence capable of carrying cutting-edge, both basic and clinical cutting-edge researches. More of these philanthropies or more of these private laboratories in our universities and research centers are encouraged in order to enhance our capability or our preparedness towards future pandemic to secure the life of our own citizens.
Also, scientist Keita advised members of the public to come forward for testing in order to know their status about COVID-19, without which it will be difficult to achieve the required success in fighting the disease.
Government, from the time we started, has spent hundreds of millions on this testing. On testing. So people should use the opportunity to come and be tested when it is free now. We don't want a situation where, because of other demands by the public, when the government might feel they might no longer pay, or maybe public individuals will pay a percentage, and government will pay a percentage. Now it is free. It's an opportunity. And then earlier, you know, your status, earlier now management will start, and then process of also prevention of spread of this disease to others will also stop.
Apart from the need for massive establishment of laboratories and COVID-19 testing centers, there is also the need for training and retraining of health personnel to be able to deal with the threat of COVID-19 and other pandemics now and in the future. From African Science Literacy Network, Salim Ashir Mahuta and Zaid Mohammed.